This episode is brought to you by Thorne, and I have some incredible news for any of you that are in the military, first responder, or medical professions. In an effort to give back, Thorne is now offering you an ongoing 25% off each and every one of your purchases of their incredible nutritional solutions. Now, Thorne is the official supplement of CrossFit, the UFC, the Mayo Clinic, the Human Performance Project, and multiple special operations organizations. I myself have used them for several years, and that is why I brought them on as a sponsor. Some of my favorite products they have are their Multivitamin Elite, their Whey Protein, the Super EPA, and then most recently, Cinequil. As a firefighter, a stuntman, and a martial artist, I've had my share of brain trauma and sleep deprivation, and Cinequil is their latest brain health supplement. Now, to qualify for the 35% off, go to thorne.com, thorne.com. Click on sign in and then create a new account. You will see the opportunity to register as a first responder or member of military. When you click on that, it will take you through verification with GovX. You'll simply choose a profession, provide one piece of documentation, and then you are verified for life. From that point onwards, you will continue to receive 35% off through Thorne. Now, for those of you who don't qualify, there is still the 10% off using the code BTS10, Behind the Shield 10, for a one-time purchase. Now, to learn more about Thorne, go to episode 323 of the Behind the Shield podcast with Joel Totoro and Wes Barnett. This episode is sponsored by Team Builder, yet another company that's doing great things for the first responder community. As a strength and conditioning coach myself who also trains tactical athletes, dissemination of wellness information is one of the biggest challenges. Now, Team Builder is the premier strength and conditioning software for tactical athletes, and there are several features that really impress me. Firstly, there is a full exercise library, so you, the personal trainer, does not have to create that within your own department. Secondly, you can send out programming, but also individualize, which I love. So you blanket program for everyone. Now you can tweak based on someone's injury, someone's need to maybe drop some body composition, rather than having to write a program for every single person on their own. Team Builder also allows you to build custom questionnaires to collate health and wellness data. It integrates with wearables. And I think one of the most important things is obviously it tracks. To me, it's imperative that we as a profession start tracking our people from day one and then over the full span of their career, therefore catching potential wellness issues and injuries before they happen. Now, if you want to try Team Builder, they are offering you, the audience of the Behind the Shield podcast, a free 14-day trial to experience all of the features. And if you want to take a deeper dive into Team Builder, listen to episode 1032 with Melissa Mercado, or go to teambuilder.com. And I'll spell that to you because it's not as you'd think, TEAMBUILDR.com. Welcome to the Behind the Shield podcast. As always, my name's James Gearing, and this week it is my absolute honor to welcome on the show veteran nurse and the woman behind the Conversing Nurse podcast, Michelle Harris. Now, in this conversation, we discuss a host of topics from her journey into the world of nursing, pediatrics, neonatal nursing, infant mortality, mental health in her profession, and so much more. Now, before we get to this incredible conversation, as I say every week, please just take a moment. Go to whichever app you listen to this on, subscribe to the show, leave feedback, and leave a rating. Every single 5-star rating truly does elevate this podcast, therefore making it easier for others to find. And this is a free library of almost 1,100 episodes now. So all I ask in return is that you help share these incredible men and women's stories so I can get them to every single person on planet Earth who needs to hear them. So with that being said, I introduce to you Michelle Harris. Enjoy. Well, Michelle, I want to start by saying two things. I think it might have been DD Finder that kind of brought us two together. So I want to thank him for that. And secondly, I want to welcome you onto the Behind the Shield podcast today.
Thank you, James. It's a thrill and an honor to be here. I appreciate you having me on. And yes, DD Finder is an awesome individual and introduced us.
Brilliant. So where on planet Earth are we finding you this afternoon?
So I'm in Central California, a town called Visalia, and we have about 160,000 residents here. It's an agricultural community. So we're surrounded by fruit trees and nuts and dairies and cattle, all kinds of things. We are very central to everything, as I said. So the Pacific Ocean, we're about 3 hours away. Los Angeles, the same. San Francisco, the same. Yosemite, a couple hours. The Sequoias, a couple hours. So it's just the sweet spot of California, I think.
Are you near Kings County?
Yes. So Kings County is just about 20 miles to the west of us.
I think I was literally just where you live. A few weeks ago, I went and helped a friend who's temporarily the Kings County fire chief.
Oh,
And
my
we
gosh.
had a conference in one of the Indian reservation casinos that's right in your area.
Yep. It was probably in Lemoore, California.
Yeah. So,
Yep.
yeah, I literally know where you're talking about, and it was beautiful.
Oh, my gosh, James. I wish I knew you were here. I would have driven over to see you.
It was a whirlwind visit. So,
Yeah.
okay, so I would love to start at the very beginning of your timeline. So tell me where you were born and tell me a little bit about your family dynamic, what your parents did, how many siblings.
I was born in Reno, Nevada, and then we moved here when I was 5. So I've lived in Visalia for 56 years, if I do the math. I am the third child of 8 children in our family. And I always say number 3 is the place to be. Our family dynamic, very interesting. So my father was a salesman, repairman for National Cash Register Company. And I can't believe that he made a lot of money, but we never seemed to lack anything. You know, we had our 3 meals a day. We had our little tract house here in Visalia. We had a swimming pool. And then I had my 7 siblings. So 5 brothers and 2 sisters.
And
It's
was
a lot
your
of math
mom
to do.
was your mom a stay-at-home mom with that many children?
My mom was a stay-at-home mom, yes.
I'd be interested to hear your dad's take on the trajectory of his profession, because here we are now, and certainly after COVID, cash is almost like a dirty thing these days, but that was his bread and butter back then.
Yes, this was obviously long before days of any kind of technology. And my dad, let's see, trying to unpack my dad here. So my dad he was a survival instructor in the Air Force before he met my mom. And they met in Reno at Stead Air Force Base. And my dad came from the background. He grew up in Oklahoma, very poor, not great parenting. He was the child of a single mother. And so his life was pretty rough. And then he met my mom, and my mom came from a family she had 1 sibling, and her parents were both educators. So they were both master's prepared. So a little bit different. My dad always teased her that she grew up with a silver spoon in her mouth. And she kind of did a little bit, but her family dynamic was really crazy too, because her parents would do things like just speak to each other in French and not speak to my mom. And then she lost her brother when he was a senior in high school, and my mom was a sophomore. So that was completely devastating. And the way that her parents kind of processed that was the day after he died, they removed everything from the house that had any remembrance of him. So everything came off the walls, everything came out of his room, and it was like he never existed. And my mom is 85, and she still talks about that to this day, and is actually in grief counseling, which I applaud her for. After 70 years of losing her brother, she finally decided to get some help for herself. So these are two imperfect people meeting and then deciding to have a family and bring 8 kids into the world. My father was a good man with a bad disease of alcoholism. And subsequently, I lost one of my brothers to alcoholism, and another brother is permanently disabled because of alcoholism. So those kinds of things have you know, obviously affected our entire family dynamic growing up. It was a little bit chaotic. I always kind of joke around because my younger sisters, one of them is 11 years younger than me, and the other one is 15 years younger than me. They had a different experience with my parents because my dad was sober at that time, and my mom was less of a codependent. And so things were better for them than they were for the first 6 of us.
It's interesting because I think we talked about my book briefly as well. Like, this is the whole point of telling this multi-generational trauma story. And we recently have talked about our parents and how did you grow up, but then you unpack their childhood and then their grandparents' childhood, and you see these dominoes falling. So going to your mom for a moment, I think that's so admirable that someone who's, deeper into their lifespan has the humility to say, I think I'm going to work on myself. That is incredible. So what was that turning point for her after, decades and decades of trauma herself?
I think she's just coming to the end of her life. And I mean, I asked her, why now? Like, first of all, I said, bravo. And then I said, what was your motivation of why you're doing this now? Kind of exactly what you asked. And she said, I just didn't want to die without having visited this, how his death impacted my life, my entire life. And again, for my mom to say that, because my mom has really strong defense mechanisms up, and kind of like, I'm never wrong, doesn't often apologize for things that, were in her realm to apologize for. So just to see it, it's kind of amazing and inspiring. And it just goes to show that it's never too late to get help for yourself if that's what you want.
Absolutely. Well, let's talk about your kind of career ambitions. When you were in the school age, were you already dreaming of the medical profession, or was there something else in mind?
I was not dreaming of it. I will say that my mother was in nursing school, and she had made it halfway through nursing school when she met my father. And so this is in the late 1950s. And you could not be in nursing school and simultaneously be married, which I think is just so crazy. So she met my dad, and it was kind of this whirlwind thing, and they wanted to get married. And so she dropped out of nursing school. And of course, I grew up with this story, but it still never made me want to be a nurse. I think the first inkling of wanting to be a nurse is, well, I'll say the first inkling was really when I was 7 years old. So my father, as I said, was a salesman and a repairman. And this was Christmas Eve. And he said, hey, we need to go down to the office. Do you want to go with me? Which was very unusual because with all these kids, it was usually going to be a thing where everyone jumped in the car and went down with Dad. But he asked me, do you want to come down to the office with me? I have to do something. And, I said, yeah, sure. So on our way, we passed by this man that was laying pretty much in the gutter. And my dad said, look at that bum. It's Christmas Eve, and he has no one. He's laying in the gutter alone. And I just remember at that point so strongly feeling such a deep, hurt for that man, that he had nobody, and it was Christmas Eve. And as you can imagine, a 7-year-old on Christmas Eve that has been waiting all year for Santa to come, and the excitement. And, all my brothers and sisters, we were just beyond excited. And it was just a crushing reality. And this man was probably homeless, although we didn't have a term for it at that time, or unhoused. The term was kind of like a bum, and so that, I think what that instilled in me was just a compassion for another human being. So the second pivotal decision really was as a young teenager. When I was a preteen, my grandfather had a massive stroke, and they lived just about 2 blocks from us. And so my two older brothers, were really tasked with helping care for him, because my grandparents had promised each other, we're not going to put each other in a nursing home. So he stayed at home, and my brothers got up every day before school and went to care for him. They turned him, they cleaned him, they changed his catheter. They did all of these tasks when you care for someone. They fed him, they got him up in the wheelchair. And I saw that every day. And, boys that are 15, 16 years old, this isn't something that I think is normal. They're usually going to school and, roughhousing and I don't know, partying maybe, but they were caring for my grandfather. And then when they graduated high school, they became nurses. And so they were really the inspiration for me to become a nurse, mainly because we got to hear all their stories. So they would come home, and they were still living at home at that time, and just tell stories around the dinner table of, patients that they took care of. They were both working in the operating room, and just the surgeries and the surgeons and all the interpersonal relationships. And it seemed really exciting. And I was like, yeah, that's the life for me.
Well, going back to the 7-year-old you, it's interesting because if you take that scenario, which we see to this day, and I hate the word bum. I mean, I've said it many, many times in my books and on here. I can't stand that word. But really, you've got a hurt person looking down at another hurt person. And this is the issue that we have. The empaths, the people with compassion, look at those people and go, God, that's someone that needs help. But the nastiness or the shallow, lack of compassion usually is coming from a person who's struggling themselves. So they're not able to really kind of connect with that person, I think, because they see a mirror in some respects. So it's interesting now where I think people are finally starting to really allow that conversation to happen. And empathy and compassion is now viewed as a strength. Whereas, for the longest time, there was, as a man, this kind of, just judge everyone else because you're in your ivory tower, so you get to point fingers at everyone else, rather than this courageous vulnerability that we're seeing now, where people are like, no, I'm broken in a infallible way, not in a I'm beyond help, but I am imperfect myself. So let me work on myself and let me help raise other people up. So a lot of that nastiness that we're trying to dismantle now comes from hurt people judging other hurt people.
Absolutely. I've heard you say that before, hurt people. And looking back, thinking what was in my dad's head when he said that and he called that guy a bum. My dad was an alcoholic at that time. And it was almost like a message, like, don't be, like a message to himself, almost like, don't get there. Don't be laying down in the gutter. You don't want that to happen. And towards the end of my dad's disease, before he got sober, that's exactly where he was. And it was extremely embarrassing. I remember my older brothers getting a call from the owners of a grocery store that was about a mile around the corner from us. And my dad had drank so much that he was laying down in the gutter. And these people knew us and they said, hey, you need to come and get your dad. And, my brother still talks about it to this day, of how humiliating that was, to have to drive over and put his, inebriated dad in the car. And then after that, my dad got sober, thankfully.
And what was the turning point for him? Because, I've got a friend at the moment, a childhood friend that's struggling, and he's been, had amazing success in certain addiction programs and then just fallen off over and over and over again. And he's just so full of guilt and shame. But this is a guy who's trying to claw his way out, but this disease just keeps dragging him back into the pit.
Yeah, I think there was a conversation between my brothers and my dad where my brothers were like, wow, this is really affecting us, because people, while you're in it, they're not talking about how it's really affecting you. And they were pretty much adults at that time. They were late teens, 18, 19. And they said, wow, this is really distressing, and we don't want this to happen again. Don't let it happen again. So my dad started going to Alcoholics Anonymous, and for him, it worked. And, to the day he died, he was sober for 30 something years after he passed away. Before he passed away. I guess after he passed away, he's sober too, right?
I was thinking it. I wasn't going to say it.
But yeah, he maintained his sobriety through AA. And I know for many people, AA works. My brother, who was permanently disabled, has been in AA for many years and has still continued to drink. So for him, it's not working. So yeah, it's a tricky thing, alcoholism. And what you want to do is break the cycle, right? You don't want your kids, growing up to be alcoholics. And I think that's what we're all striving for, is to stop this generational disease.
Absolutely. Well, you mentioned the compassion and empathy that you witnessed in your brothers, and correct me if I'm wrong, were they kind of early in the male nurse movement too? Because that seems like, that's something that wasn't seen as much back then.
Absolutely. In my brother Chris's graduating class in 1980, I want to say, there were actually 5 male nurses, which was very unusual. And they all went into the operating room or emergency room nursing. And that still is the pattern today, James. When you see males, obviously there's more males in nursing today. I think it's up to about 12%. But in the 80s, I know it was under 5%. So males in nursing are still going into those emergency room, flight nursing, ICU. They seem to be drawn towards the more adrenaline-based specialties.
So walk me through your journey into nursing then.
Okay, I started nursing in 1982. I graduated high school and I was taking courses concurrently towards my nursing degree. Graduated from nursing school in 1985, so this is a long time ago. And started in pediatrics. And my reason for going into pediatrics was just sort of ridiculous. There was no thought behind it. I was 21 years old, and there were 4 positions at my local hospital because in the 80s we had a nursing glut, if you can imagine that. So there weren't very many positions. And I saw pediatrics, and my thinking was, wow, pediatrics. Okay, I like kids, and I come from a large family of kids. So, like, how hard could it be? And it was really hard because it's not just kids. And, kids are great when they're not ill. And then you add illness, and it changes the whole dynamic. And then, of course, kids don't come alone, they come with their parents. And that's a whole nother dynamic as well. So it was really difficult for me to navigate the whole pediatric realm, but I quickly did, and I really learned to love it. I stayed in pediatrics for 18 years, and then I had the opportunity to go to the neonatal intensive care unit. And so I did that, and I never regretted going into the NICU. I absolutely loved it. Again, kids, very sick, very difficult, parents, very worried, all those dynamics. But I spent the next 18 years of my career in the NICU until I retired in 2022.
Beautiful. Well, going back to, I've never heard that word before, nursing glut, which I'm assuming means more nurses and physicians. That seems to be very different than what we're seeing now, especially in my profession. The people are screaming out. And I know why we're struggling at the moment, but I don't want to load the question. What was it about the environment in the 80s where you had the equation tipped the right way, more nurses than physicians?
That is a great question, James. I don't really have an answer for that. I don't know why, but it quickly, I will say the 80s were great because we seemed to have good staffing. We had no ratios at that time, which we do here in California. But I don't know. I don't know. The patients weren't as sick, so they weren't coming in with all these comorbidities that they are coming in with now. So someone coming in for surgery in 1980, they were probably fairly, I guess, healthy, as we would say today, using our metrics today, than they are now. Somebody coming in for surgery now might have type 2 diabetes, high cholesterol, obesity. There's a lot of different factors today. I don't know if that really influenced it, but I know that even from the 80s to the 90s, it changed dramatically. In the 90s, it seemed like we really started having a lot of staffing problems, and it became very challenging. And by the time I retired in 2022, that had not changed. So for, 3 decades, the staffing issue was always something that I had to deal with, and, probably every other nurse.
Well, let's go back to the comorbidities for a second. You've got this pediatric lens and then this neonate lens. Obviously, I would imagine the pediatric has got more time for pre-existing diseases to manifest and obesity and those kind of things. With the last 4 decades, what have you seen overall as far as the body composition issue with our young people and then the associated diseases that are bringing them into the hospitals?
Yeah, I will say, particularly in the NICU, when I moved to the NICU, it was it was like 2007, 2006, 2007. And in the, decades that followed, the pregnant mothers coming in had so many comorbidities. So type 2 diabetes, obesity, a lot of obesity. It seemed to just blow up. In our area, we're in a rural kind of impoverished area. There's a lot of poverty. So in around 2010, 2012, we saw a huge increase in the use of methamphetamine, cocaine, heroin. So we were seeing pregnant women come in that were on these drugs that had sexually transmitted diseases. We saw a lot of syphilis, a lot of gonorrhea. So these moms coming in, they had hypertension, and I'm not talking about pregnancy-induced hypertension, although we did have a lot of pregnancy-induced hypertension. These were women in their 30s coming in with primary hypertension in their 30s. We saw a big change in the age of our women coming in. So if you're a woman and you're pregnant, you're considered an elderly mother. And that term always like throws me off. But in the obstetric community, that's how you're classified, as an elderly mother. And so we would see a lot of moms coming in their late 30s, 40s, even 50s. And so, as you can imagine, as you age, these comorbidities just increase. And they were delivering prematurely because of these comorbidities. The babies were smaller. The babies were sicker. The babies stayed longer in the hospitals. The mothers were sicker. Many mothers were going to the intensive care unit after delivering or even before delivering so that they could get stabilized. So, just a huge increase from just in those 3 decades of practicing nursing.
A couple of my guests have mentioned, and I'd love to get your take on this, that unbeknownst to most of us, the US has a terrible outcome when it comes to infant mortality, if I'm using the right term. So
Yep.
Talk to me about that, because we would have, somewhat arrogantly assume that, well, we're all fine. We're a first world country, we're the greatest country in the world, beating our chest. But then, as you've detailed, there are many, many elements that aren't very healthy for, a young boy or girl to be born into. So talk to me about the where we actually rate as far as the outcomes of our childbirth.
Yeah, I can't give you any hard statistics, but it's pretty common that we suck as a nation regarding infant mortality, and specifically Black infant mortality. So it's multifactorial. There are what we call care deserts. And these are areas that, because they are impoverished, because they are low socioeconomic, it's difficult to get physicians, obstetricians, advanced practice nurses, anybody that sees pregnant women. It's difficult to get those providers into the area. Okay. So you're not having a lot of professionals coming into the area. So the ones that are here are burdened with a really high population of patients. So there's long wait times. I will say that the model of care that we've seen, over the last few decades, actually, this has been the model for a long time, is very paternalistic. So, you're usually seen by a male physician, and there's some, I don't know what the word is. Sometimes women are ignored in terms of when they come in presenting with things, oh, I'm feeling this or that. And they're kind of told by their provider, well, you're pregnant. You're going to experience that. But it's something deeper. And oftentimes it's not looked into until it becomes a true emergency. And then the woman ends up in the emergency room and she's having an abruption, and, her and the baby bleed to death. So things are kind of getting pushed aside and not really delved into deeper. That's a problem. The care deserts is a problem. And, I will say that our town that I live in, Visalia, we are experiencing a care desert right now, which to me is amazing because our local institution is a teaching institution. We're affiliated with UCSF, USC, Stanford, so Cleveland Clinic. So we have all these affiliations. And then our biggest private obstetrical group, that's a mouthful. They just closed down. And they have hundreds of patients that they're seeing. And so they sent out a letter and they said, we're closing. And about 2 weeks later, they did. So now there's all these women that are just looking for care and having to find care in other places. And I think, how does this happen? How does this happen in a town that's growing, that is, affiliated with all this great care? How are we now going to this place? And a lot of it is because there's increasing amounts of litigation. Labor and delivery is one of the most highly litigated specialties. So these physicians are complaining of really high malpractice insurance premiums, and they're trying to run a business because, let's just say it, it's a business, right? They're not doing it for free, and they're finding it more and more difficult. So a lot of these physicians in this group kind of got absorbed. They became hospitalists, so or laborists, they're called. So what they do is they do shift work now. So they take shifts and they stay in the hospital and they see all the patients on the labor and delivery unit that need to be seen. They're there so that if there's an emergency C-section, they can do that. And, the research has shown that laborists improve the care that women are getting in the hospital because they don't have to call anyone in from their house and wait 15 minutes for them to get there. If the woman needs a C-section immediately, they can do it because they're right there. So they have better outcomes. So I think all of those are contributing to the low infant mortality. But I feel like the main one is the condition that the mother is in before she even gets pregnant.
When you're talking about that closing, I'm seeing a lot of this on my social media now. And it's not like I'm following rural hospitals or rural medical centers specifically, but I keep seeing that over and over again, that they're closing.
Yep.
And what's interesting to me when you're talking about, an organization that has all these very, very prestigious universities attached to it, it really parallels what I'm seeing here in Marion County, where I live. We have the Florida State Fire Academy in my county, and all these young people are going through, but none of them are working for the county where I live. And it's because people look at, at all the conditions on paper and go, well, this looks terrible. 56 hours a week, mandatory overtime. You've had six suicides, or 5 actual suicides, 2 attempts in the last 5 years, if anyone actually does their research. This is horrendous. I'm going to go down to somewhere that actually values their people, like Gainesville, for example. And so we're losing all these young people. And I think it's the same with what you're talking about. What is it about the environment, as you mentioned, the craziness of the lawsuits that we have in this country? Of course, there's a time and place for that. But we have so many ambulance chasers trying to make lawsuits out of nothing that it's just destroying the medical profession in general. But, and then the working conditions and the ratios and the satisfaction ratings and all these things that are people are held by these corporations that own hospitals and medical centers, rather than locking back into truly just wanting to help people. Like you said, the 7-year-old you looking at their man in the gutter. That's what's burning in most of our hearts, but it's just being torn apart by the working environment itself. I'm sure the people in labor and delivery still love delivering babies, but it's diluted. So if you were queen for a day, how would you change the environment so that we can reverse this crisis that's going on in your community?
Man, that's a huge task, James.
We've got all day.
Yeah, right. I think it just has to start. Man, I don't know where it has to start. It maybe we just have to go back. Okay, I will say working for an institution. What I don't like, and I know it's the reality, is the business side of it. I think medical care being incentivized as a business is a really bad idea, because what you're going to do is you're going to get people that the people that have money are always going to get the care, right? Because they can pay. The people that don't, and in our community, I'll say that we have a high population of Medi-Cal, and so Medi-Cal is our like a Medicaid for California, and because we have a lot of poor people in California. Amazingly, I know people think of California as just all celebrities and rich people. Those are there's deserts of rich people, but many people here are not wealthy by any means. And so the people that are just getting by are going to get medical care. Medi-Cal, usually every community that you go to in California has somebody that provides service for Medi-Cal recipients. What's happening is, I'll say in our local hospital, is we have about 70% of our population is Medi-Cal. And Medi-Cal traditionally doesn't pay very much. So who eats that? The hospital eats that. And they eat it they have to reduce costs elsewhere, right? So they don't pay their employees very much, their nurses very much. They don't have very good benefits. Now, our hospital was self-funded as far as insurance, which is kind of unusual, but it's a great gig if you can get it in your hospital, in your community, because we had really good benefits for the employees. But I don't like the idea of medical care being turned into a business. And I don't know, like, you're familiar with the NHS, and that's kind of like a Medicare for all in the UK, if I'm not mistaken. But, is it also looked at as a business? I don't know.
It's interesting because, again, I'm not, an expert in the NHS and all the working, moving parts. However, I do understand that it ultimately came from simply wanting everyone to have, care. Full stop. That was it. It was coming from an altruistic place originally. And if I was just thinking while you were talking, if you go way back to ancient humans, there wasn't, Steve the Inca. I don't know why I always call it Inca Steve, but anyway, Steve the Inca didn't have to show his, insurance card when he broke his leg. No, the tribe came together, the witch doctor, whatever it was, their version of taking care of each other existed in that tribal space. It wasn't to profit off the other Incas. And so when I look back at in its purest form, the NHS, which I grew up in, I had, rural doctors. I went to, inner city hospitals. It was amazing. Our doctor was incredible. And I've always said this, my grandparents paid for these supplementary, it's called Bupa, which is extra private insurance that you can pay for. And they got their own clinics and it's all very la-di-da. Like you said, the wealthy people, will always have care. Well, they priced my grandparents out of their plan. I mean, they lived to be, my granddad was 99. My grandmother was almost 105 when she passed. And my granddad died of cancer. tough as old boots. He freaking got T-boned in a car one day at like 50 miles an hour after pulling out in front of someone,
Oh my
and
gosh.
literally walked it off. Like 97, 98, whatever he was then. But that's how they discovered ultimately through scans later on that he had this cancer. But Bupa had already dumped them by that point. The premiums were so insane they just couldn't afford to pay when they really needed the help now. They'd invested for years and years and years. So the NHS was who took care of them. And I watched my local doctor do numerous house visits. They had hospital beds set up. He had hospice care. He had nurses visit. After he passed, they helped with his body, and then they came and got the furniture a little bit later, and then they kept visiting my grandmother for a few weeks after that. That was the NHS. So this is what I tell people. Yes, you're going to see those examples of some inner city hospital where someone dies in the waiting room. We have that in America too.
Mm-hmm.
But at its core, and it isn't at its core now, what you see in the NHS now is they began trying to privatize parts of it, a couple of decades ago now, at least. So they've torn it apart by trying to use the American model, which, as we just discussed, if you have a profit-based healthcare system, it's not going to benefit the health of the people because we need sick people to make money. So to me, if you actually had an NHS style system that you didn't, adulterate through privatization, your entire goal then is to make the nation as healthy as possible so that you use as little tax money as possible. We have the complete opposite here. You've been in your profession a lot longer than I was in mine, but I saw it firsthand. There's no money in healthy people and there's no money in dead people, but you can be the world's best drug dealer for the people in the middle. If you're sick and alive, you're my cash cow for decades to come. So I think that the original model of the NHS, to me, is by far the best system on the planet, but it has to be funded properly. And if you go back home, certainly, again, when it was supported properly, the doctors were driving Mercedes. It was a well-paid profession, but now it's been more and more under-supported. And I remember even back when I was younger, nurses going on strike. So, but if you really create that altruistic healthcare model and then invest in it, say, no, this is going to need more government money initially, but then you're saving money hand over fist because your nation is getting healthier and healthier. To me, that's the perfect one. And then even what we just talked about, infant mortality, it's affecting that now too, because the mothers that are coming into your L&D are now far more healthier and far less likely to have any complications.
Right. Yeah. And, I've talked to a lot of nurses now on the podcast, and, many of them, they don't have any answers either, because what it comes down to is they just want to take care of patients. They want to be able to spend time with their patients. They want ratios that are manageable, that we know from lots of research, the less patients the nurse has, the better the outcome for those patients. The more patients the nurse has, the worse outcome for those patients. And it's like, well, why do we study this stuff if we're not going to implement, proper ratios? And again, I will say I'm in California and we have ratios, but there is also ways that hospitals get around ratios, so nurses, physicians, and I'm sure it's the same in the firefighter community. You were motivated to go into that profession because you want to help people, whatever that means. That's always kind of a broad kind of stroke. I want to help people. Well, okay. But then you're faced with all the bureaucracy that comes with it. There's no money. There's crappy shifts. There's things that you're seeing that you can't unsee, and there's no mental help for that. So I don't know what the answer is, James. I don't know what the answer is, but something's got to change. And I think, I don't know what the answer is. I'm at a loss.
Well, I think it just goes back to, until we really lean back into kindness, compassion, empathy, community, then we're not. And as long as these lobbyists are lining the politicians of both sides of the aisle, then we're going to keep having this sick care system that we have at the moment, and we're going to keep losing so many people. I mean, the whole Black Lives Matter movement, for example, I still waiting for them to talk about the obesity crisis. It's killing so many African Americans in this country, way more than all the other things that are also need to be talked about. But this is it. I mean, there's this distraction of this conversation, and even COVID. I mean, my goodness, there was that little ticker on the news stations. Oh, we've lost this many. Well, that went away. Well, we're still losing that many to to everything else that's killing people. And I would argue that COVID was just finishing off a lot of people that were very, very sick already. So when it comes to truly caring about the health of the nation, I'm not seeing this from anyone. And even, I really liked RFK prior to the election, and there's all these promises about make America healthy again. And in 5 months, all they've done is talk about red food dye. So there we go. I mean, you've spoken loudly. Clearly, there's no desire to actually fix it at all, because we're in May now and nothing has changed. So I think the people have to get educated, have to get angry and rise up and demand something different, because the way that we're doing it has resulted in 70+% of this population being overweight or obese. And we're losing millions of people to all things related to that. And as you mentioned, it's never discussed, we're losing infants, we're losing pregnant women, and where's the conversation? Where's the outrage in that?
Yeah, there's none. There's crickets chirping. That's what I always like to say. There's crickets chirping. And what we hear with this current administration is, like you said, we're 5 months in and there's been very little change, if any. It takes time. Okay, yeah, I've heard that all my life in the nursing profession. You don't change these things overnight. Okay, now I was hearing that in the 1980s, and now it's 2025. And the nurses I talk to are still hearing that. And we're tired of it. And nurses are leaving the profession. Physicians are getting trained and they are not going back to their communities. They are going on to where they can make the most money, where they can live in the places that, are nice to live in, that have great weather, that have great socioeconomics. I will say that I'm very proud of my niece and my nephew-in-law. They are physicians here locally. They grew up here. They went to medical school. They came back here with the desire to practice in the community that they grew up in and to serve the community. But they're outliers. That doesn't happen. And so we have these deserts where we don't have practitioners, and people have to drive, many miles, hundreds of miles to find care. And it's just not acceptable. And the insurance companies are dictating what physicians can do and what they can't do in their care. And we have physicians leaving, and yeah, it's a big mess, and we just need a complete overhaul. But I wouldn't know where to start. Health policy has never been my thing, as far as I don't have any literacy really in health policy. I'm learning so much from my guests in that realm. So it's just a multi-dimensional problem, and one that I don't see being resolved very soon, sadly.
I find the term, oh, it's complicated, or it's going to take time, just the rhetoric of the coward. Simply because, wow, you managed to find a vaccine for an unknown virus in a few months, and you were getting that all over the place. You were able to shut down the planet overnight. So you're telling me that you can't make these reforms that are killing, over, like you said, the span of your entire career, hundreds of millions of people. You're still, air quotes, working on that problem. So I think the only way that we change it is we get, like I said, everyone needs to get educated. And that's why I loved seeing The Pit when that came out. I don't know if you've watched that show yet, but
I haven't. I don't have. My goodness. I know I don't have HBO Max, and I'm just like digging my feet in. No more cable channels. But I need.
If you're able to, I think, because what I've done with those is just subscribe just for a month to watch it. Sometimes you're going to get
Yeah.
a free month, and then I turn it off again. But
Yeah.
it hits so many of the areas. I think you'd really enjoy it. And it's, the medical side, they're bang on. There's other thing is actually, there's not a childbirth case, I don't think, in their particular story, but it was really well done. But it highlights the ratios, the pressure from the admin. I mean, the violence on nurses. I mean, so many things that need to be talked about. But it's so good for people to see, like, no, this is just a regular Tuesday, and the triage area is completely full, and the medics are waiting to offload patients, because that was what pissed me off during COVID. Oh, you get these journalists in the hallway. There's people in the hallways. Like, there's always fucking people in the hallways.
It's like,
Where
yeah,
were you
there's
the other? You didn't give a shit a few weeks ago, and now you're acting like this is the end of the world.
yeah, it's ignorance. They don't know what goes on in the fire service. They don't know what goes on in hospitals. Most people would be completely horrified to find out what we do on a daily basis, and completely traumatized. And you're right. Maybe it would cause people to rise up and say, do you see what's going on in hospitals? Do you see that nurses are being attacked? Do you see, that firefighters are killing themselves? This isn't right. We know that because we're in it. But I think the general population really doesn't see it or have any idea about it.
That's why I'm working on getting Kinda made into a show, because to me, you got to reverse 1984 it. You got to use a television to educate people. That is the ultimate classroom. So if you can create something that really pulls them in, and I got a parallel project that will actually educate kind of on the side as well, then you circumnavigate all the politics and all the corruption and all the filters, and you just get right to the person's heart. So I think there's an opportunity to do it through the screen, but I've just got to make it happen.
Yeah. And I will say, James, that, I was one of those people that I just spoke about that didn't know what went on in the fire service. And had I seen firefighters in my community? Oh, absolutely. But had no idea the challenges that they were facing. And then, when I met you, I was at the time in my podcast career where some of my listeners and my guests were saying, hey, why don't you kind of branch out a little bit and interview disciplines other than nurses? Which was saying, we're sick of hearing about nurses. No, they weren't saying that, but they were challenging me. And so that's when I reached out to you and I said, I don't really know anything about what you do. And so I got your first book, One More Light. And that really, man, that just blew me away because I really had no idea. And then I absolutely loved your second book, Kinder, because that put it in the perspective of a story. And you just brilliantly told that. And it gave me just so much insight into being able, and I know I reached out to you because I was going to interview my local fire chief, who happens to be my neighbor. And I was just at a loss. I'm like, I don't know how to prepare for this. And so you suggested that I listen to your episode with Hugh Bruder out of Florida there. And I did. And it just was so helpful in really just helping me understand all the challenges that your profession is up against. When it comes right down to it, all you guys want to do is help people. You want to help your communities. You want to make your communities better, safer. And you want to do it in a way that doesn't destroy you, right? So that when you put in your 20, 30, 35 years, whatever it is, years of service, that when you retire, you're not dying, 2 to 5 years later. And so, I just wanted to say I appreciate all the help that you gave me interviewing Charlie. And I think I enjoyed that interview. And, I heard some of the same things that you've been talking about, that, because I did propose to him the 24/72 shift. And I backed that up with all your great information that you've been talking about for so many years. And, he said, yeah, that sounds great. but, right?
Mm-hmm.
But we don't have money and we don't have staff and all the same things that you've heard over the years. And, I didn't push it because I don't have enough, uh, I don't know, clout behind me. So to challenge him. But he was aware of your work, and that's good. That's a first step. And I think absolutely what you said earlier, it takes people being educated. So if you're going to be a firefighter, if you're going to be a nurse, maybe before you even enter into your training, start looking into what you're going into so that you don't go into something that you didn't think, you know, that you didn't know about, that you didn't know what were the potential pitfalls of going into this profession. Because we all just start with that burning desire to get out there and help people and serve, help our communities. And then we run into these issues which cause burnout and all those other things that follow. So that was a long way of saying thank you for helping me prepare for that interview.
Oh, you're welcome. This is a beautiful thing, though. I learned so much from speaking to you, and this is, I think, when your friends challenge you to interview other people, this is what I found has been the superpower of my podcast too. Is just you could be interviewing a gymnast or an astronaut or a veterinary surgeon, and the parallels between some of the things that they struggle with and the ones that we do, you remember, like, oh yeah, that's right, you're a human being that does this job. You're human first. And so then some of the solutions that they found in completely different disciplines, you're like, well, why are we not doing that in the fire service? Why are we not doing that in nursing? They're doing this in Norway or this in England or this in, the Finland's schoolhouse, whatever it is, and you start realizing, oh, there are actually solutions out there, but that takes humility, and that's the other thing is you got to get people educated, and you got them to just drop that the way we've always done it, because the way we've always done it doesn't work. Otherwise, we'd have nurses, fighting for positions, we'd have firefighters fighting for positions, and we'd have a nation of super healthy people. But that's not the case. So
No.
it's not about doom and glooming it. It's about people that care. Like you said, we're out of our uniforms now, but we still care because we still don't want people to suffer. We still don't want people to die. And so now, being this force multiplier, you and I have got a microphone instead of a stethoscope. And we're like, okay, well, that's, we as a profession need to force change because people admire nurses, they admire firefighters and paramedics. So united, we would have an incredibly powerful voice, but we're so siloed and so overworked and exhausted that it's really hard to rally the troops.
Yeah, I always just tell people to imagine your community with no nurses and no firefighters. You go into the hospital and, you go into the emergency room with, whatever, an injury, and there's nobody there to take care of you. Your house is burning down. Your husband's having a heart attack. I'm sorry. Oh, you called 911. There's nobody to respond. And, people laugh and they say that would never happen. And I say that would never happen because of the people that are in these professions that care enough to never let that happen. But if only for those people, if it's for other people, if it's for, the insurance company, the institutions, I don't know if they would care so much.
Well, you touched on some of the challenges that my profession faces, and we've talked about some of the challenges that the patients face themselves. What are some of the lesser known elements that are affecting the nursing professions? I mean, again, the men and women in your profession work shifts. We see again some of the ill health, the obesity and some of these, the smoking is one that really blows me away, but this profession sees these people that are so sick, and yet the need to stay up, the need to, deal with the stress. A lot of times you'll see people smoking outside of ER when they've got lots of people dying from the very thing that they're leaning into. So what are some of the overall issues that you want to highlight when it comes to advocating for your people?
Yeah, that's a great point, James. Nurses are great caretakers, except when it comes to caring for themselves. And, we know it. Uh, we're just not good about stuff like that. And, I had Dee Dee Finder on my show, and he highlighted it so beautifully. He said, because we were talking about how nurses are, many of us are very deconditioned. We don't exercise on a regular basis. And the lie we tell ourselves, and I definitely told myself this lie many, many years, was I run my ass off for 12, 13 hours. I'm getting exercise. That's a lie. It's not the right kind of exercise. I wasn't lifting any weights. I was exhausted at the end of the shift. So the next day I didn't do anything, but I kept justifying it to myself that, hey, I ran, I probably walked, 13, 14, 15,000 steps yesterday at work. So that gives me the right to just sit on my ass today. And, I see this multiplied by many, many, many nurses. And a lot of it is just, sheer exhaustion. So we're just going to do the basics. I will say for myself, in 2009, I was diagnosed with breast cancer. And I look at the years leading up to that diagnosis because I was young, I was only 45. And I was like, what was happening in those years before I got diagnosed? I was working. So our NICU was growing so fast that we had no staff. We had just brought on a neonatology group, which means we're keeping sicker, earlier babies. And we were also in the middle of a methamphetamine crisis in our county. So we were having these moms come in that were sicker and delivering these babies that were more premature, and the babies were sicker. And our NICU was growing. So we had more patients who were sicker, the acuity was higher, and so forth. And they implemented in our hospital, they implemented what was called extra shift incentive. And it was really good. The money was really good. So we could make an extra $400 per 12-hour shift. And there weren't many nurses that turned that down. So what happened was we all jumped on board with it. And I had two girls that were just going to start college at that time. And I'm not one who likes a lot of debt. So I said, let me see how many shifts I can work so that we can pay cash for these girls to go to college. My husband was a teacher, and he wasn't as flexible in his job. He couldn't really, quote unquote, work extra. So he worked his regular, Monday through Friday job, but I had a lot more flexibility in my job. So during those years, I was working 5 to 6 12-hour shifts per week. And what happens when you're working that much? Something has to suffer. So physically, I was not doing anything except running around all day at work. On my 1 to 2 days off a week, I was not doing anything physically, not working out. I did not have time because I would get home at 7:30 at night. So meal planning was out. My husband really didn't cook. One of my girls had left home and the other girl was at home, but she was working full time, so didn't have a lot of time. So we were eating out a lot. I was getting off shift at 7:30 and we'd go out to eat. And then I would try to go to bed by 9, having eaten at 8. And I wasn't sleeping. I wasn't eating well. I wasn't taking care of myself. I was just working, coming home, and did that for several years. And oh yeah, I could pat myself on the back because, we put 2 girls through college without any debt. That's a whole nother issue. that needs to be overhauled, right? But we don't have an extra 2 hours for that today. So, at 45 years old, I'm getting, I'm sitting in a doctor's office and he's telling me you have breast cancer. You got to remove that breast and have chemo. And so I did that. That was my wake up call. And we all hope we get a wake up call, right? And that was mine, that something's got to give. There are more important things than money. Your health is one of them. And so that started my journey into really taking a look at what I could change in my life. At that point, I never said, I want to get out of nursing, because it was like a badge for me. It was a badge that I wore proudly. Look at me. Look at how many hours I've worked this week. It wasn't just about the money that I was getting, although that was highly attractive, and I was proud of that too, but it came at a price. So that's when things really changed for me in terms of looking at, you got to do something different. And yeah. And so going back, I kind of got off, went down a rabbit hole there. But what Dee Dee said was, nurses are deconditioned. They're not working out. They're not lifting weights. They're sitting around in the ICU, and then they have to go turn a patient or do a procedure on a patient or lift a patient, get a patient out of bed. And they're going from like 0 to 60 in 2.5 seconds. So they've been sitting, and then they're going to get up and lift this, 250, 300 pound person, and they're hurting their backs. They're, they're tearing their shoulders, and then they're going out on disability. And so, yes, we have to look at all the things we're preaching. We have to practice what we preach. And we preach this to our patients all the time about, don't smoke, don't get fat, exercise, take care of your mental health. But then when it comes to doing those very things that we're preaching, we're really bad at it. We're getting better, but we're not there yet.
That badge of honor, that, I'll sleep when I'm dead mentality, is one of the enemies of the wellness movement in our profession. And sadly, because they're so understaffed at the moment, they're enabling these people to work more and more and more, whether they're forcing them, truly volunteering, or what happens in the middle. I'm sure it's the same with you, is there's that group where they're working so one of their other firefighters doesn't get hit because they just had, a newborn baby or whatever it is. So you take one on the chin for them. But if you put it in any other profession, that just wouldn't fly. If you work for a grocery store and they're like, okay, we need you to work 3 extra days a week, you'd be like, no. If you worked in a bank, you worked anywhere else, a dental office, it's not going to fly. But the mismanagement of a hospital or a fire department always falls squarely on, the responder, the nurse. And like you said, in some cases, there's a financial incentive. But it's so irresponsible because, you highlighted it perfectly with your story. It's a false economy. Yes, you had a few extra pennies for working, but what was the true cost downstream of overworking an employee? So yes, it's about ownership, but it's also really ultimately about managing the place of employment. Because if that overtime isn't there, then guess what? The employee can't overwork. It's physically impossible. And then you educate them if they work on the side to, or, actually put it in writing, like, you cannot work overnight on your day off. Like, yeah, go landscape, go, build cabinets, whatever you want to do, but you have a responsibility to be well rested when you come back. So it's always on the nurse, the firefighter, the police officer, and no one really says, well, wait a second, why are there so many vacancies in the first place? I've literally had chiefs tell me if we give them more time off, they'll just work more. I'm like, what an arrogant thing to say. They will not be able to work more if you actually know how to manage your fire department, because there will be no vacancies apart from once in a while. So the reason why your story is told as it is, even though, like you said, yes, there was a financial benefit, had your organization staffed themselves properly, you would never have been down that road in the first place, and possibly never even had to have the medical journey that you had.
Yeah, that's absolutely true. That's the crux of the matter. And funny, we had a very intuitive manager at the time in the NICU that when they instituted all this overtime, she told us, you guys have to be very careful about this, about not working too much. I know it's because we had people going, oh, now my husband can buy that boat that he's always wanted, and I only have to work this many overtime shifts to do it. And, she said, you got to be careful, because you got to take care of yourself, and you can definitely go down this rabbit hole at the thought of, making all this money. And man, she was right.
Well, I want to get onto, the mental health side as well, but just before we do, this can be, some severe calls, it can be some beautiful outcomes, whatever it is. But when you reflect, back on this incredible journey that you had with pediatric and neonate patients, what are some of the outcomes that really stuck with you, positive or negative?
Positive, definitely anytime that you have a child come in that's gravely ill and you can be part of the team that turns that around, and then you see that child go home with his parents without any, bad sequelae, like that is just so gratifying. It's like that cements why you're there, why you're doing all the things that you're doing. And it's not just one person, it's a team, and loved working on teams. But yeah, and the same for NICU. We would have some very premature babies that weighed less than a pound, that were hospitalized for 5 months, that went through hell and back. And to be able to see those parents, take that child out in their arms, doing well and starting their life, is just very gratifying. I think that's why many people go into the profession. Negatively, I just think the cumulative stress of seeing what you see on a daily basis, I guess, it's as Dee Dee said, and he quoted it from somebody else, the death by 1,000 cuts, the moral distress of not being able to care for people the way that you should be able to care for them, the way that's ethically responsible to care for them, and then to go home and have to live with that it's really difficult. It's really hard on your mental health. And there's not many people that you can talk to about it. As far as like in my family, my husband definitely would always be a listening ear, but didn't really know all the ins and outs of the profession. Although there were 6 nurses in our family, so many of my siblings are nurses, we didn't really talk about the things that laid heavily on us to each other. And after interviewing so many nurses, I find that to be true as well. Like in the day-to-day, nurses don't talk to each other about those things. They don't talk to each other about, the patient that they took care of for, weeks died. We just handle it ourselves. We don't talk about it. Thankfully, there are debriefs now. And we had a great clinical educator in the NICU that did some great debriefs when we would lose babies, and that helped a little bit. But each person is responsible for their own mental health. We didn't really rely on each other for that, which is sadly, when I think back now, like, man, I was working alongside these people, but I had no idea what they were bearing, and nobody ever asked me. And I don't know why that is. Is it the same in the firefighter community?
Yeah, It really is. I think one of the problems is that you probably look across the NICU at each other and go, well, Steve or Sylvia is doing fine, so I'm going to keep my stuff to myself. But they're looking across at you thinking exactly the same thing.
Yeah.
Because as I've said, if I go into a fire, I can't run around screaming like a queen saying, oh my God, it's so hot. I've got to get in there, put my big boy pants on and do the job. But
Yep.
then you pull out, a child, you do have to process that at some point. But we wear these masks so well, the same way as you would have to during, whatever it is, working with a child, that we forget that you've got to pull that thing off when you're done, in your flow state, working as an actual, in the operation of the field. But I think it's becoming more and more of a conversation now. I think this is what's great about these young firefighters, paramedics, nurses, is they're coming in with a lot more emotional intuition and vulnerability. So now it's tempering it and getting them to understand, okay, this is when you really have to just roll up your sleeves and get on with it. But then absolutely, we need to be able to converse and say, yeah, that was horrible. And when I think about the ones that were, the worst, they all involve children. And that's what you work with your entire career. So, of course, it's going to be a massive load, in pediatrics and neonates, because let's be honest, it's the most sad of events. These poor little boys and girls have barely had a chance to even have this existence, and it's taken from them.
Yeah, I will highlight something that happened in my career. My first year, I was 21, brand new nurse, 1986, and I had my first pediatric death just a few months into my practice. This was a little girl that died of pneumonia, overwhelming sepsis, and her parents had just left for the night to go home. Because at that time, James, this is so ridiculous, we didn't let parents stay overnight in the hospital with their children. So imagine being the parent of a sick child and the nurse is telling you, it's 8 o'clock, you got to go home. Who does the child want when they're sick? They want their parent. Developmentally, we know that's really bad to separate them. But we did that, and the parents left and the child died. And then we had to call the parents back, and they were about 30 minutes away. And, it was just incredibly horrible. And, I was tasked with the postmortem care of this child, and I had to put the child in a body bag. And I remember zipping up the body bag and stopping the zipper right at the neck and not wanting the face to go into the bag. And the nurse that was with me said, you have to zip it up, the whole way. And I said, but she's not going to be able to breathe. And, this nurse was very intuitive, and she said, it's okay, honey. She's not breathing. She's died. So obviously I hadn't processed it by that time. Now, what would happen today if that happened? That nurse would be sent home for the shift. If the manager had to come in and take over her patients, that's what would happen in our hospital anyway. And that's better. And then they would reach out to that nurse and get her hooked up with some kind of mental health, some kind of a therapist to help the nurse process this. So that's a great change in the last, 36, 40 years from when I went through it.
You mentioned about some of the, the baggage basically that you carried into the profession. I think this is really important for people to understand. A lot of us that do this, that are empaths, usually have got some stuff in their early life. And whether it's, parents battling alcoholism or domestic abuse, or child abuse, or whatever the thing is, you see that a lot. Now, that doesn't mean that it's going to be, detrimental, but it is if it's forced down, if it's left unaddressed. I think it does become a fracture in our foundation then, and it needs to be part of the overall conversation of mental health in our professions respectively. When you reflect back now, where were the lowest places that you got, and then what were the tools that you've used to grow from that, to get that post-traumatic growth?
Wow. I will say you are absolutely right on about that, about people that enter the helping professions are usually bringing a lot of baggage with them, right? And so in my own case, growing up in an alcoholic family, being a victim of sexual abuse, a lot of childhood trauma. And I'm bringing that into a profession. And I know now from talking to so many nurses that that's exactly what's happening on a grander scale. But none of us are talking about it. I worked alongside nurses my whole career that I never knew anything about their family history, what they had suffered. I had no inkling. And they were probably suffering some of the same things that I had. And so I think you're absolutely right. We take all this childhood trauma, and for many of us, it's unprocessed trauma, into our professions. And we try to care for people with all of that stuff. And we kind of lose ourselves in the process. As far as my journey, I don't think there was like a time where I got so low. I think early in my career, in my 20s, I started seeing a therapist to help heal some of that childhood trauma. And I think that served me throughout my career because I could recognize it in others, and I could recognize some of the things that I did, like, my people-pleasing personality, just kind of always putting my needs on the back burner. And it's, what do you need? How can I care for you? I learned some of those techniques to kind of correct some of those things. But, I don't think it was any one thing. And I've always been a proponent for, if you need to talk to somebody, seek out a therapist. And I've talked to several therapists, and some of them were good for me and some of them were not good for me. And so that, again, and I know that you've spoken many times about finding a therapist that is familiar with your profession and all the things that you encounter in your profession, to help you with those issues. And I back that 100%. So, yeah, I just, maybe to your point, again, before you head into a profession, look at what you're in for, and try to do some healing of your own stuff before you take that stuff into your profession.
Absolutely. Well, the other side of the conversation is the transition, and it's very, very it seems to factor in with most people's transition. When we wear a uniform, we have this tribe, we have this identity, we have this purpose, and then whatever it is, whether it's actually retiring, whether it's getting hurt, whether it's getting fired, whether it's even promoting out of a fire station to a desk somewhere, you see a lot of people struggle with that. What was your transition like from nursing, where you've been this healer, you've been this, as you mentioned, even this people pleaser for so long, and then one day you walk out the hospital and your ID doesn't work anymore?
It was rough. It was rough. So this, sometimes I talk about divine intervention because I believe in that. And, shortly after I retired, I discovered your podcast. And one of the very first episodes I listened to was Sebastian's younger. That was a great episode. And I went and bought his book, Tribe, on homecoming and belonging, because I was really in the throes of missing my tribe, missing the teamwork, the camaraderie. Nurses would come to my desk and just sit and bullshit and talk about, just the struggles that they're having, maybe in their home life or with another coworker. And, I was missing that. I got to see all the parents of the NICU every day in my job, got to sit down and talk to them and see what their struggles were and how they were handling, having a baby in the NICU. I missed all of that. I missed rounds. We would have grand rounds every day. And I missed rounds. I missed wearing scrubs, that's insane. The scrubs are the worst things you can wear. I miss all of it. And this was only after a few months. The first 2 or 3 months after I retired, it was like the honeymoon period. It was like I was doing all the things that I couldn't do when I was working all day. I was baking, I learned how to make macarons. I was going to the library and I had a stack of books that I was reading. I was walking miles every day. I mean, I was just like, this is freedom. And then about the third month it set in and I was like, oh man, this is bad. And I kind of had prepared myself a little bit. I knew about a year or so before I was going to retire. And I said, you might have trouble disconnecting from this nurse identity. So I consulted a therapist to help me with that. And she was very helpful with that. And at that point, I had already been in the beginning preparation stages for having a podcast. And that was a whole nother thing because I had just recently become a listener. And I tell this story because it's just so ridiculous, but I think it's a nurse thing. It was like, I think I'm going to start a podcast and I'm going to talk to nurses about nursing. And like, how hard could it be? You just get a microphone and you start talking. And I wasn't prepared for the learning curve. So I had to learn that really quickly, but that was fun. And it was just a lot of introspection. Sebastian's book was really helpful because, the tribe is really important, and a lot of things we do in nursing, and I know that this happens in all kind of first responder communities. It's all about the trauma bonding, right? It's like we are bonded over all these things that we have seen and done. And, I just was like, if I'm not a nurse, like, what am I? I have spent 36 years being a nurse, 40 years at this hospital, badging in and out of this door and that door and having authority and having credibility. I guess I could say credibility instead of authority. I probably didn't have much authority. That was in my own mind, but I had credibility, and then now it's just gone. And I got a few tastes of like how we treat retired people in our country. I don't know if this happens in other parts of the world, but it's just like, okay, you're done. There's no value to you anymore. And it's really sad. So yeah, that was kind of my journey. And, one of the things that Sebastian talked about in his book, and I know you've talked about this too, because again, a lot of first responders are in the CrossFit community. And I will say I was a proud member of the CrossFit community for 2 years, from 2018 to 2020, at the start of the pandemic, until our gym shut down. And then I never went back. But I had never, outside of nursing, I had never experienced that tribe feeling. And I absolutely loved it. I absolutely loved it. I did CrossFit like 4 to 5 times a week. I never did anything strict. So I never did a strict pull-up. I had to scale everything. But it was some of the 2 best years of my life because of that community. So caring, so motivating. When you're down and you've got nothing left to give, someone is there saying, you can do this. I see how strong you are. You're an athlete. I had never been called an athlete in my life. I didn't do sports. I did more creative things, like I was a band geek and stuff like that. And so to be called an athlete and to be part of this tribe was just, it was an amazing 2 years of my life. And I credit my sister Jennifer for getting me into that. Although she did trick me into it. So, but it turned out well.
Did the gym reopen after COVID?
The gym did reopen after COVID. It took a good few months, and I will say one of the biggest mistakes in my life was not going back at that point. I was just incredibly stressed working in a hospital during COVID. And I probably needed CrossFit more than anything during that time, but I didn't go back to it. And I have regrets about that.
It's never too late.
That's what people keep telling me. And I'm just like, oh man, I had so many injuries in CrossFit. Just, because being a beginner and all that. But I just loved it. My favorite was the Fran. I loved the Fran. And, my best PR was my deadlift was 105 pounds. I'm so proud of that too. So, I look back on that with just a lot of happiness. And oddly, I've wanted to approach the gym owner to start like a CrossFit for seniors, because what do seniors need? What do they start having problems with balance, right? They start falling. They lose their community, especially if they're retired. So they lose their tribe, and they are lonely a lot of times. And, if I was queen for a day and I had all the money that I needed to start a senior CrossFit gym, I would do it in a heartbeat.
So my gym where I train, they were CrossFit for a long time. They still do a CrossFit class. But actually, one of our main coaches now is one of the young athletes. I don't know exactly where he placed, but he was extremely good in the kind of teen divisions. But we moved to a thing called Wolf Brigade programming. So it's a lot more, all strict movement pretty much. There's maces, there's kettlebells, there's
Yes, I've
sandbags, there's
seen
sleds.
that.
And it's so good. But it's funny what you were talking about with the community. I was in a funk yesterday. I've just jumped back in after having that horrendous flu that was going around about a month ago. And so, there's always that. The older you get, it hurts even more when you first start going back.
God, true.
And I went back and I came home and I told my wife, I was like, I feel really good. And I think it was less about the exercise and it was more about just going there and, being with the friends that I've trained with for years and having that community and joking, and they were playing some silly music. And it was that part, just like you said, the
So
tribal element.
true. Yes.
So getting the programming to be switched so there's more strict stuff, because that's what you need, scaled but strict. As you get older, you don't need to be, ripping things off the ground and doing kipping pull-ups and those kind of things. But getting that community back. So I concur 1,000%. I think that's exactly what you should do next.
That might be my next big endeavor, James. Yeah, I just would love to see that, because I'm in that community now, right? I mean, when I retired at 57, so that was an early retirement, and I feel blessed every day that I could do that financially. And now it's been, I just turned 61, and, I am feeling different physically the last, 4 years. I've done a lot of things in retirement to help me physically. I walk, many miles a day. Walking is my thing. But I still am cognizant that, as a postmenopausal woman, I need to be strength training. So I just recently joined my gym and I'm lifting weights, but it's not the same as CrossFit. I will always be this CrossFit fan. There's a lot to be said for it. And, yeah, I if anybody out there wants to invest with me in a senior CrossFit gym, let's do it.
One more area before we kind of round off with some closing questions. You touched on working during COVID. You're in this pediatric neonate environment. without loading the question at all, what was your perspective of those years as far as the amount of issues that you saw with the patients themselves and the impact on your men and women that you work with?
Yeah, thanks for talking about that. So thankfully, during COVID, we had 0 babies that were infected with COVID. Now, we had many mothers that were infected with COVID, and they were quite ill. Some of this was pre-vaccine, some of this was post-vaccine. We had a lot of mothers that were very reticent, hesitant, whatever the word is, to take the vaccine while pregnant or while they were even planning to get pregnant. Because at that time there wasn't a lot of research. And so we had a lot of moms that were going into labor early because they had such severe COVID disease. We lost a lot of moms to COVID. So we had a lot of premature babies. Moms went to the ICU. They came in with like pneumonia. They came in with sepsis. They were very, very sick. And again, as we spoke earlier, they had a lot of comorbidities. So a lot of these moms were older. They had type 2 diabetes. They were obese. So all these comorbidities. And they landed in the ICU and they were put on ventilators, very, very sick. Their babies were delivered very, very early. So 25, 26 weeks. These moms stayed in the ICU for months and ultimately died, never got to meet their babies. So being a nurse, seeing these families, ripped apart, it was devastating. So we didn't have any babies that had COVID, but their families definitely suffered. I'll say the nurses suffered in terms of staffing during COVID, of course, was very crazy because all resources were going to the units that had COVID patients, which were many. So our nurses, if our census was down in the NICU, they had to go to other departments and actually take care of patients with COVID. And this was a stretch for many of our nurses in the NICU because nurses that go into NICU nursing, they make it a career. They don't usually leave. So they really had not taken care of adults and adults with such severe disease. So many of our nurses ended up getting COVID and being out with COVID. So it impacted our staffing dramatically. Politically, what happened pre-vaccine, so when COVID was first making its debut, and I know that you've talked about this because it happened in the firefighting community as well, nurses were hailed as heroes. We had the banners outside of our hospital. Thank you, heroes. It was crazy, James. We were getting sent gifts were arriving on our unit. Food, we were getting sent food by organizations, by restaurants in our community. It was kids in schools were writing us letters. And I always say nurses don't do it for the applause because we don't, and neither do really any first responders do it for the applause. But for the first time in our careers, we were getting a lot of applause and it felt good. I can't lie. It felt good. Well, then the vaccine came and there was so much controversy. It split, just like it split so many families. It split so many nurses, so many doctors. We had one side that was saying, get the vaccine, it's completely safe. The other side was, this is a conspiracy to kill us all and don't get it. And then we had nurses that were refusing to get the vaccine and were being fired. We had nurses that were leaving to work in other institutions that weren't requiring nurses to have vaccines. So after having this really high point where the community was rallying around us, and thanking us for our care, and then immediately to dive into this just divisive community where, everybody on social media was like, oh, the hospital is doing this, and the hospital's lying about their COVID numbers to get more money. And meanwhile, the nurses on the ground, the boots on the ground that are caring for the patients, are going home with, complete moral distress because they're having to cut corners, and they're worried about their patients dying. They're worried about infecting their own families with COVID. My siblings and I were caring for my, 85-year-old mom, who was 82 at the time during COVID and had some comorbidities. We didn't want to even go visit her because we were afraid of her dying from COVID. So, it was brutal. It was brutal. And after talking to so many nurses now, a lot of nurses left after COVID. And I will say that was a mitigating factor in my retiring from nursing. After COVID, it was just like, oh my God, I can't believe, I made it through that. Yeah, it was brutal.
Well, this is what's so important, is hearing everyone that was, boots on the ground. Because by that point, I was out the fire service. So I was watching these guys, get off the rig, covered head to toe in full PPE, and, only one person going in, and, all these different precautions. But what was so sad is you talked about it perfectly. I mean, like, you had these two extremes, and the middle common sense voice was absent. It was completely politicized at the expense of the people who died, the first responders, the medical professionals. And what really angers me is, after the fact, there was very much like, well, we don't want to talk about it now.
Mm-hmm.
It's like, whoa, time out. Now is the time that we do need to talk about it. What are the lessons that we learned? What should we do differently next time? And, going back to what we've talked about already, what are you going to do about all these, these issues, these health issues that the country is continuing to suffer from? Because this next virus, whatever you call it, is going to sweep through, and we're going to have the same exact thing. Why are you not bending over backwards now to bolster, the healthcare professions, bolster the first responder professions, and initiate programs that make, if not our children, at least our children, if not the adults as well, start turning the corner on this? But none of that happened. And it was, again, both sides of the aisle. And it just infuriates me, is everyone was up in arms about these deaths. And now on, it's like, well, you just don't care anymore. And all these, these people that put their necks out, some of whom aren't with us anymore because they were overworked and sleep deprived, and our nurses and doctors and paramedics and police officers were so vulnerable because of the way they were worked that we lost a lot of them. So I think it's so important to hear testimonies like yours to honor the people that we lost, the patients and the people helping them.
Yeah, we lost so many nurses, physicians, so many people. And you're absolutely right. After it was all said and done, there were crickets chirping. And man, I'm so glad that I'm not going to be there for the next thing that happens, but I am so worried about my nursing colleagues, my physician colleagues that are going to have to handle this.
Absolutely. All right. Well, you mentioned Sebastian Junger's Tribe. First of the closing questions, are there any other books that you love to recommend?
Yes, I am a big reader, and I recommend anything by Ryan Holiday. Have you had Ryan on the podcast?
I have not, and I need to. I mean, he's been mentioned so many times. Even Josh Brolin, who I was talking to not long ago. I'm not trying to name drop, but he's been on the show a couple of times now. He absolutely loves the Daily Stoic. So I know that, there's so many people that are impacted by Ryan's work. I need to get him on the show.
Yes, I've actually read The Daily Stoic, Ego is the Enemy, The Obstacle is the Way, Discipline is Destiny, Courage is Calling. I've read all of his books, including The Daily Dad, and I get his Daily Dad newsletter. Highly recommend it. People may wonder, why is this 61-year-old woman getting the Daily Dad newsletter, and I will say it has made me a better grandparent. You know, I have a daughter, she's 38, and you have one chance, right? Who said that? One shot, you have one shot, Eminem. It's a great song. But with all of the stuff that, you know, I brought as a parent from my childhood, you know, she's a great person. She turned out great despite me. But now my grandkids, I get to see it from a different perspective, and it's beautiful. And so I highly recommend the Daily Dad, really, for anybody, grandparents, parents. It's awesome. And then the other author that I love is Austin Kleon. He's an author and an artist out of Austin, Texas. He's a creative. I love his books, Steal Like an Artist and Show Your Work. And I think Steal Like an Artist really resonates with me as far as with what you do, James. And you know, he's always saying like, and we talked about this through Instagram because I was wanting to learn how to repost, and you post all this great content that is just, it's all about kindness and caring and humanity, and I just love it. And you do those reposts, and that's kind of like Steal Like an Artist. You're observing other people's work, and you love it, and you want to show it off, and you're giving credit to that other artist. And then Show Your Work is great because what we do, especially in podcasting, you know, that's something that we should be proud of, and we should talk about it, and we should always give credit where it's due. So those two books I highly recommend as well.
Brilliant. What about films and or documentaries?
So films, I don't watch a lot of movies, but I will recommend one that I saw that came out in, I want to say 2004, 2005, and it's called Crash. And I loved Crash for so many reasons, but so Crash tells the story, all these different stories of people living in Los Angeles. And the only actor that I can remember is Sandra Bullock. The other ones, I see their faces, but I can't really remember who they are. But it was so good there was like this good cop, bad cop. There was what it's like to be a Black man in Los Angeles. There was sexual assault. And in the beginning, you didn't see how all these people were connected, but then all the dots started to connect. And I thought it was just really brilliantly done. And I loved it. And it just shows how we are all connected. So I love that one. Documentaries, anything in the Blue Planet series, anything having to do with nature. I love any nature documentary.
My sister actually edits for the BBC a lot of times. She's worked with David Attenborough and some other ones. So you've probably seen some of her work.
I was going to say anything narrated by Dave Attenborough, because I am a sucker for a British accent, James. Complete sucker.
Well, it's funny you mentioned Crash too, because that I will give credit to. That is absolutely one of the inspirations for Kinder. And the reason being,
I see that now.
Such a beautiful job of making the viewer think a certain way at the beginning. And then at the end, you're like, oh my God, like they've turned everything on its head. And I didn't try to write a firefighter's Crash by any means, but it was that same thing. It's like start off with the way people think and then lead them down a journey. And then at the end, see if they question the way they've been, indoctrinated to think by that point. And it goes back to the bum. Is it still a bum by the time you finish with that book, or are you looking at the person who had an experience that sent them down that spiral?
Yes, I totally see that now in Kinder. And you're right. It's like we start with, we just get this view of how we think this person is. We're so quick to judge, right? We're so quick to try to figure out who this person is. And I don't know if that happens in the lay community, but definitely in the nursing and first responder community, we have to be really quick to assess the situation. And we tend to do that a lot. And we tend to end up wrong in many cases, right? Because we really have to delve into, there's more just behind what I'm seeing or what I'm hearing. There's, yeah, great film and great book too. And I'm so glad that your book is going to make it to film. I can't wait. I'm so thrilled for you.
Yeah, I don't know how it's going to get there. Yeah, lots and lots of seeds planted. So we're going to navigate a journey, but it's kind of exciting to see, which way it goes, who ends up being behind. There's some, I won't put it out there yet because this person hasn't even been approached, but there's people that have written some of the most beautiful, or directed some of the most beautiful films and written the most beautiful screenplays that are on the radar. So to me, it's got to be a humanist that gets it, that wants to change, so. But
Yes.
even Crash, I've got a friend who is good friends with the guy that made Crash. So we'll see. We shall
Oh my
see.
gosh, that's awesome.
All right. Well, then the next pair question, speaking of great people, is there a person that you'd recommend to come on this podcast as a guest?
Yes, and I have to give a quick backstory here. So, you know this, James, but I always admired that you ask people for their guest recommendations because I think you have found so many great guests by doing that. And so I reached out to you because I really wanted to do that. And I reached out to you and I said, James, I really love that you asked this. I want to ask it too. How do you feel about it? And I'm laughing because your response was just so like matter of fact. You're like, yeah, go for it. Like, I'm not the first person that's done this. Like, you can ask anything you want. But I wanted to give it respect in so far as like not be like plagiarism, right? So yes, I do have a guest recommendation, and this person is my sister Jennifer Capicella. And so you might think I'm biased. Of course, I love my sister, but I also see who she is as a person and what she's accomplished as a nurse. And I'm just in awe of her every day. So Jennifer and I are 11 years apart. I'm her senior. And she has just grown into this compassionate leader. Jennifer will do anything for anybody at any time, no questions asked. And that's family, friends, employees, fellow nurses. She is just like one of those people that would give you the shirt off her back. She is so professionally, longtime labor and delivery nurse. And I learned how to be a better nurse by watching and listening to my sister. She would always get the sickest patients on the unit, and they would often have to go to the intensive care unit. So she would go with them. And then she came to love the intensive care unit. So she became an intensive care nurse and was absolutely fantastic at it. And then she went into flight nursing, so longtime flight nurse. And her journey didn't stop there. She became the program director for Northern California for a company called REACH, which is under Global Medical Response, GMR. And I have to say, I love your interview of the two gentlemen from GMR that talked about nurse navigation. That was absolutely fantastic. But Jennifer's part of that company. And she just, what she's accomplished in her 49 years is amazing. She's a private pilot. And for somebody who has a fear of flying, man, I just give her all kinds of respect. She's been a long-time CrossFit participant. Like I said earlier, she got me into CrossFit. She tricked me into it. But she's great. She has 3 kids. She has 3 grandkids who she absolutely adores. And she has many, many stories to tell. She's just a great person. And I'm sure she'd be a wonderful guest for you.
Beautiful. Well, I would love to get her on if you're able to help make that happen.
Yes, I will.
And going back to asking permission for that closing question, like I think I remember saying, like, is it when people ask about other things? Like, I didn't invent the English language. Like they say, there's no such thing as an original thought. So going back to crediting the artist, I mean, I think this is it. This is this beautiful ripple effect of, one person does something like, oh, that's a good idea. Let me do that too. And I've had
Yeah.
people, firefighters say the same kind of thing, like, oh, I'm thinking of starting a podcast, but I don't want to tread on your toes. I'm like, I didn't invent podcasting and I'm not the only firefighter. Like, go for it. We need as many voices as we can get out there so that, someone who listens to me and it's like nails on a chalkboard, maybe you're the one that they'll want to listen to instead. So, but
Uh,
I was touched by it because of the fact that it was that respect thing, even though the response was obviously like, absolutely. I don't know how I came up with that particular thing, but I'm sure it was from listening to someone else. And this is the domino effect in a positive way.
well, I love it. And I loved your, just your humility. Like, wow, go for it. I don't own that phrase. So,
Absolutely. Well, the very last question before we make sure where everyone can find your podcast, The Conversing Nurse, and anywhere else, what do you do to decompress?
we talked about this a little bit earlier in all my walking, and I found a Latin phrase because I love Latin, by the way. I'm a huge fan of Latin. And I guess that's why I love Ryan Holiday so much, because he's always quoting the ancient Stoics and Latin phrases, memento mori, and all that stuff. But there's a Latin phrase called solvitur ambulando. It is solved by walking. And I can tell you that I have solved so many questions, conflicts, just by getting out of my head and going for a walk. It's therapeutic. I absolutely love walking in the spring, in the fall, sometimes in the winter. Our winters are kind of mild. Definitely not in the summer. I have to go to the gym and walk, which I don't love walking at the gym, but I still do it because it just, when you're doing something with your body or your hands, it takes your mind offline. And then all of a sudden, these answers just start coming to you. And it's a beautiful thing. So that's what I do.
I couldn't agree more. I think I've said this a few times on here. When I walk my dog, I leave my phone at home, which in itself doesn't sound like some grand gesture, but in this, engaged technological world that we're in, just once or twice a day, 30 minutes being off where it's just me and my thoughts, 100% something will hit me and I'll be like, oh, where did that come from? That will be, part of whatever project I'm working on. Or like you said, something you've been worrying about, you go for a walk and you come back, you're like, well, wait a second, there's the obvious answer is right here. So I think the white noise of, modern 2025 living is so detrimental to just that quiet moment where your brain can process a problem and say, oh, this is the obvious answer. So yeah, just side note, I couldn't agree more with simply walking without any device. All right. Well, then for people listening, the podcast is The Conversing Nurse. Where can they find that? And then are there any other places online or social media they can reach out to you?
Yes, thank you. So I'm on Instagram at the Conversing Nurse Podcast. I am on LinkedIn. If you just search Michelle Harris, you'll find me there. LinkedIn is a great platform for meeting all kinds of people. I have a website, the conversingnursepodcast.com, and my email is theconversingnursepodcast@gmail.com. And my podcast can be found on all listening platforms. So take a listen.
Brilliant. Well, I want to thank you so much. It's been such an amazing conversation. You and I have gone back and forth now on social media for a while, but all the different layers to your story, from the pediatric and neonate, the COVID, the health of your profession, the health of the nation. It's been such an important conversation. So I want to thank you so, so much for being so generous with your time and coming on the Behind the Shield podcast today.
Thank you, James. And I just have to say thank you for everything you're doing for your community. And it is far reaching. It has not just stayed within your community. It has obviously reached my nursing community. It's given me a different perspective, a different lens to look through, and your work is so valuable. I cherish it, and I cherish you, and thank you for having me on.